I'm Carolyn, and I'm so much more than my breast cancer. I've had many roles in my life. I'm a wife, a mother, a grandmother, a friend, a teacher. I have a husband of 44 years, 3 grown daughters, a grandchild, another grandchild on the way. I like to keep busy. I make a list every day. I was worried when I retired that I might be bored, that I might not have enough things to fill my day, but that has not been the case. I like to read. I'm in a book club. I love swimming laps. Underwater, it's quiet, it's peaceful. I see the sun sparkling on the surface. That's when I say my prayers. I do things that make me feel alive. So when I was diagnosed with metastatic breast cancer, it stopped me in my tracks. I was concerned about how much time I would have. Will I be around for my children, my grandchildren? Will I be there for graduations and weddings and birthdays? But then I realized, though my circumstances may have changed, I haven't. And the things that matter to me haven't changed either. And once I started moving again, I started taking life slower, and now I don't really miss a thing. Now going to the doctors is just a part of my life, a part of my routine, and one of my daughters always goes with me. We believe in my medical team, and we feel like they are part of our extended family. I also believe in Kisqali. It's working for me, and I trust it immensely. It's a once-a-day dose that I take in the morning, and it doesn't get in the way of me being me. Here's the truth. There are good days, and there are hard days. But I have a beautiful life. I get up every morning, and I remember that. I used to get upset about things that bothered me, but now I realize it doesn't matter. I'm definitely a more grateful person, and I'm very grateful that I'm able to do the things that I like to do and be with the people I love. One of my greatest joys is rocking my granddaughter to sleep. I love to just hold her and look at her and tell her what a wonderful world she's been born into, what a wonderful life she has. My overall approach to living with metastatic breast cancer is not to let it control me. I mean, it's a part of me now, but it's not who I am. I've chosen to continue on, and I literally choose every single day to be happy.
What is Kisqali? Kisqali, ribociclib, is a prescription medicine used to treat adults with hormone receptor, HR-positive, human epidermal growth factor receptor 2, HER2-negative, breast cancer. In combination with an aromatase inhibitor for stage 2 and 3 early breast cancer, with a high risk of coming back, that has gotten worse or has spread to other parts of the body, advanced or metastatic breast cancer. In combination with an aromatase inhibitor as the first endocrine-based therapy, or fulvestrant as the first endocrine-based therapy, or following disease progression on endocrine therapy. It is not known if Kisqali is safe and effective in children. Important safety information. Kisqali may cause serious side effects, including lung problems. Kisqali may cause severe or life-threatening inflammation of the lungs during treatment that may lead to death. Tell your healthcare provider right away if you have any new or worsening symptoms, including trouble breathing or shortness of breath, cough with or without mucus, chest pain, severe skin reactions. Tell your healthcare provider or get medical help right away if you get severe rash or rash that keeps getting worse, reddened skin, flu-like symptoms, skin pain or burning, blistering of the lips, eyes, or mouth, blisters on the skin or skin peeling, with or without fever, heart rhythm problems, QT prolongation. Kisqali can cause a heart problem known as QT prolongation. This condition can cause an abnormal heartbeat and may lead to death. Your healthcare provider should check your heart and do blood tests before and during treatment with Kisqali. Tell your healthcare provider right away if you have a change in your heartbeat, a fast or irregular heartbeat, or if you feel dizzy or faint. Liver problems. Kisqali can cause serious liver problems. Your healthcare provider should do blood tests to check your liver before and during treatment with Kisqali. Tell your healthcare provider right away if you get any of the following signs and symptoms of liver problems: yellowing of your skin or the whites of your eyes, jaundice, dark or brown, tea-colored, urine, feeling very tired, loss of appetite, pain on the upper right side of your stomach area, abdomen, bleeding or bruising more easily than normal, low white blood cell counts, neutropenia. Low white blood cell counts are very common during treatment with Kisqali and may result in infections that may be severe. Your healthcare provider should check your white blood cell counts before and during treatment with Kisqali. Tell your healthcare provider right away if you have signs and symptoms of low white blood cell counts or infections, such as fever and chills. Your healthcare provider may tell you to decrease your dose, temporarily stop, or completely stop taking Kisqali if you develop certain serious side effects during treatment with Kisqali. What should I tell my healthcare provider before taking Kisqali? Before you take Kisqali, tell your healthcare provider if you have any heart problems, including heart failure, irregular heartbeats, and QT prolongation. Have ever had a heart attack? Have a slow heartbeat, bradycardia. Have high blood pressure that is not controlled. Have decreased thyroid gland function, hypothyroidism. Have problems with the amount of potassium, calcium, phosphorus, or magnesium in your blood. Have fever, chills, or any other signs or symptoms of infection. Have liver problems. Have kidney problems. Are pregnant or plan to become pregnant. Kisqali can harm your unborn baby. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment with Kisqali. Females who are able to become pregnant and who take Kisqali should use effective birth control during treatment and for at least 3 weeks after the last dose of Kisqali. Talk to your healthcare provider about birth control methods that may be right for you during this time. If you become pregnant or think you are pregnant, tell your healthcare provider right away. Are breastfeeding or plan to breastfeed? It is not known if Kisqali passes into your breast milk. Do not breastfeed during treatment with Kisqali and for at least 3 weeks after the last dose of Kisqali. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Kisqali and other medicines may affect each other, causing side effects. Know the medicines you take. Keep a list of them to show your healthcare provider or pharmacist when you get a new medicine. What should I avoid while taking Kisqali? Avoid eating grapefruit and avoid drinking grapefruit juice during treatment with Kisqali, since these may increase the amount of Kisqali in your blood. The most common side effects of Kisqali in people with early breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, increased kidney function test, decreased platelet counts, nausea, headache, tiredness. The most common side effects of Kisqali in people with advanced or metastatic breast cancer include decreased white blood cell counts, decreased red blood cell counts, increased liver function tests, infections, nausea, increased kidney function test, tiredness, decreased platelet counts, diarrhea, vomiting, headache, constipation, hair loss, cough, rash, back pain, low blood sugar level. Kisqali may cause fertility problems in males, which may affect your ability to father a child. Talk to your healthcare provider if this is a concern for you. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Kisqali. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including patient information, on this website.